All right, so it's time to come clean and tell you exactly why Lenire did not work for me. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 239, and today I want to talk to you guys about the Lenire device and why it did not work for my tinnitus. But before I do, if you could do me a huge favor, click the like button, really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. So, about a year and a half ago at this point, I published my first video talking about the Lenire device, and it was because they had some really impressive data come out of their TINT-A2 clinical trials showing that a ton of people got benefit using Lenire to reduce their tinnitus symptoms. Now, I was actually traveling out to work with Mr. Beast on his video where he was treating a bunch of people with hearing loss, with hearing aids, which was a really, really cool time. But I remember actually posting that video and seeing that it got like tens of thousands of views within the first few hours, and I was like, holy cow, this is something that people are really, really interested in. And at this point right now, that video that I published has about 1 million views, which is crazy. Now, the thing is that I said in that video that I was super excited about it because I have tinnitus myself and I wanted to see if the Lenire device actually reduced or got rid of my tinnitus completely. And so I really want to kind of go through this with you guys and explain exactly why I have not done a review video on Lenire at this point. And to give you guys a little bit of a background here, I was diagnosed with tinnitus back in 2002 when I was in Marine Corps boot camp. The audiologist there, they identified that I had a hearing loss in my right ear, and then they asked me a series of questions. One of those questions was, do you have any ringing or buzzing in your ears or in your head? And I said, well, yeah, doesn't everybody? Because at that point I had had tinnitus for so long that I just assumed that it was something that everybody had. And at that point in time, it was really something that negatively impacted my life in terms of, trying to go to sleep at night if it's in a quiet room, or if I'm traveling even to this day to a hotel room and it's dead silent, all I hear is ringing and it's hard for me to fall asleep. Also, when I'm trying to focus and concentrate, which I do a lot of because I do a lot of video work, I'm often by myself, creating scripts and researching and all of that, and the tinnitus sometimes can get out of hand. And so that is something that I had to deal with for a number of years. And so when I finally got to grad school, I learned a lot more about tinnitus, what the causes of it are, what things you can do to try to manage your tinnitus. And they even tried to treat my ear with a hearing aid to try to reduce the perception of tinnitus. And while hearing aids are great for tinnitus management for most people, for me, it did not have any perceived difference on my tinnitus symptoms. So at that point, I was like, well, I'm probably doing everything that I could possibly do at this point. And to be quite honest with you, I had been doing a good job. I had gone from having probably a moderate to severe level of tinnitus, and I had gotten it down to where it was very manageable. And that really, and I did that through different lifestyle modifications and self-awareness and just things that I was doing that I was doing on my own to manage the perception of tinnitus. When I go to bed at night, I run a fan, or I'm wearing something that's giving me sounds like nature sounds that helps to mask out the perception of the tinnitus. But honestly, I've been doing as good of a job as I could possibly do for my own tinnitus, to the point where it was no longer negatively impacting my life. But that is the problem when it comes to Lenire. So a lot of the data that we have coming out of the TINT-A1, TINT-A2, and TINT-A3 clinical trials, and I just did a review of the TINT-A3 clinical trial that I'll link in the description as well, but the thing that we found out from that is that you really have to have a moderate to severe level of tinnitus for you to be able to use this device and get a significant amount of benefit from it. So if you have a THI score, which is Tinnitus Handicap Inventory score, of 38 or higher, then you are considered to be a good candidate for Lenire. If you are a 37 or below, you are not considered a good candidate for Lenire because your tinnitus is not bad enough to justify using it, because the amount of reduction that you'll get probably won't either be significant or won't be perceived by you. And myself, I retook the THI prior to looking into getting treated with the Lenire Tinnitus Treatment Device, and I have a score of 17 on that. And had I taken that back when I was in the military, when my tinnitus was really kind of off the chain, I probably would have been in the range to where I would actually need to use Lenire to try to reduce my perception and annoyance to my tinnitus. But because essentially I've done such a good job, I guess I'm patting myself on my own back here, but because I've done such a good job of managing my tinnitus through other areas of my life, I am no longer a good candidate for it. And so I did not see that it was a good idea to actually go through and use the device when the chances of me getting benefit are not good. And then I'd be sharing with you guys that, well, I did it, it didn't work for me, when I know that it works for a lot of people. And the reason that I know that is not only the clinical trial data, not only the FDA approval and all of that, but the reason I know it works is because when it was first released, I guess I'll start with this first. When it was first released in the United States and they got FDA approval, they picked out by hand, I think 20 different tinnitus specialists from around the United States to actually launch Lenire in the United States. So Neuromod had these audiologists out, they trained them on their units, they said incorporate it with what you're already doing from a tinnitus treatment standpoint, because we need to do some validation trials to see if it actually works in a clinical setting, not just in the laboratory setting, basically. And one of those audiologists is Craig Casper, who's actually my partner at Modern Tinnitus. He's been treating tinnitus for 20 plus years, extremely successful at treating tinnitus and getting really good treatment outcomes. You should hear about some of the stories that he shares when it comes to having success with tinnitus treatment, and that's even before using Lenire. But they ended up rolling it out to the United States, and they're like, listen guys, we need to figure out in a clinical setting if this is actually everything that these clinical trials are telling us that this device is. And so a lot of them started using Lenire in their clinic for individuals who were deemed to be good candidates for Lenire. And what they're finding is basically the same thing. Individuals who have a moderate to severe level of tinnitus, who have a THI score of 38 or higher, end up getting significant relief from using the Lenire Tinnitus Treatment Device. People who are below 37 tend not to get very much benefit from Lenire, at least not enough to potentially justify the cost. But the other caveat here is that this device is not a cure-all. It's not that you can just go like, well, don't do any other lifestyle modifications and start using Lenire and you're gonna do great, you're gonna get rid of your tinnitus. That's not how it works. You can't have everything else jacked up with your life in terms of your body movement, your mental state, your nutrition, your sleep patterns, your stress levels. You can't have all of that stuff out of whack and expect to use Lenire and get a significant reduction. It only is really effective when you have it as part of a comprehensive treatment program for your tinnitus. And that's really the reason why we started Modern Tinnitus out here in Scottsdale. I wanted to have a service to where you don't just use a one-size-fits-all treatment option for everybody, because let's face it, most clinics out there are just giving hearing aids to people with tinnitus and say, here you go, use hearing aids, treat the underlying hearing loss, which honestly is a good idea, but it doesn't work for everybody. So what do they do when they have patients who come in and hearing aids don't work? Well, they're not really addressing all of the other areas that are negatively impacting someone when it comes to tinnitus. And so we wanted to develop a Modern Tinnitus method, which is a comprehensive program that we can take patients through so we can look at every aspect of their life and employ biometric tracking to see which treatments are working and which treatments are not as effective. And Lenire is just one of those things that we do inside of the clinic, because you can't just expect to use this device and have that be the only thing that you do and get a lot of success when it comes to tinnitus. Some people probably can, but not everybody. And when you're gonna, open up a clinic, at least anytime I get involved in a clinic, I want to make sure that we're doing everything possible to serve as many people as we possibly can, especially when it comes to tinnitus, because tinnitus is extremely tricky to treat and treat the right way. So I guess the moral of the story here is that, I talked about wanting to use Lenire back when I first talked about it a year and a half ago from the time of me recording this video. And a lot of people have been calling me out online saying, hey, you said you were going to use it and you didn't use it, and now you're telling us that we should use it. Like, what's the deal? And people calling me a con man and stuff like that, and whatever it is. And the truth is that I'm not a good candidate. I would not have met the inclusion criteria for using Lenire as a treatment for my tinnitus, and it is what it is. So I didn't want to go out and make a review video when I'm not someone who falls into the range of someone who would use Lenire. So you can take that for what it is. I still think that Lenire is probably going to be the most effective treatment that we see here over the course of the next 10 to 20 years using bimodal neuromodulation. And honestly, I don't think it'll be even close. I know that there are other devices that are going to come out that do essentially bimodal neuromodulation, just in a different way. We'll see if that ends up being as effective. Right now, we don't have any FDA approvals for any other devices. If you want to use bimodal neuromodulation and use it effectively, really the only one with FDA approval at this point is Lenire. And so I'm really excited to be able to offer this in the greater Phoenix area for individuals, but also provide more information to you for your tinnitus treatment journey and help you understand that there is no silver bullet to treat your tinnitus. I was hoping that there was a silver bullet for me to treat my tinnitus back in the day, but the sooner that I realized that that was not a reality, the better I was able to cope with my own tinnitus and manage my own tinnitus significantly better. But hopefully this video has been productive for you guys. Hopefully it explains to you exactly why I did not make a video on the Lenire device in terms of me using it myself and giving you guys the results. We'll see what happens in the future. Of course, if my tinnitus ends up getting worse, you better believe that the first thing that I'll do is speak with Dr. Craig Casper over at Modern Tinnitus and find out what we should do from a treatment standpoint for myself to get my tinnitus back under control. But hopefully I never actually get there. That being said, guys, I really appreciate you hanging out with me here today. Again, hit that like button if you haven't already. And as always, we'll see you next week.